Welcome to our webinar for stem cell transplant patients and caregivers. The transplant team understands that this is a difficult and stressful time for you and your family. We are here to help you through the transplant process. Please do not hesitate to call upon any member of our team with your questions or concerns. Understanding stem cell transplant, autologous and allogeneic. There are several different acronyms for a stem cell transplant, but they all mean the same thing. To stay consistent, the whole process is referred to as a stem cell transplant. There are many diseases that can be treated by a stem cell transplant, even more than we can fit on this slide. What are stem cells? They are immature cells that grow up to become red blood cells, white blood cells, and platelets. Stem cells are created and live in the bone marrow. Bone marrow is a flexible tissue that is inside of our bones. Red blood cells carry oxygen to all of our cells. White blood cells fight infection, and platelets help us clot when we are bleeding. This picture illustrates what a stem cell can do. It can become a red blood cell, a white blood cell, or a platelet. This process is called hematopoiesis. So, what interrupts this process? Many diseases can disrupt this normal function. This can cause an excess of some types of blood cells or cause stem cells not to mature. In some cases, a stem cell transplant can help to treat the disease that is disrupting the system. What exactly is a stem cell transplant? It's a procedure that replaces diseased blood cells with healthy cells. The cells are from a donor source or from the patient. The patient then receives chemotherapy, with or without radiation therapy. The collected stem cells are then infused into the patient's bloodstream to restart their blood cell production and function. Your doctor will explain what type of transplant is best for you. This is determined by many factors, including your disease and expected response. The difference between the types of transplant is the source of stem cells. In autologous transplant, you are your own donor. In allogeneic transplant, donors or cord blood units are used. There are 5 steps to the transplant process. We are going to go over each one, and your nurse coordinator will talk to you in more detail about these steps and how they apply to you. It is required that you identify a person or group of people close to you to act as caregivers for you after transplant. A caregiver is often a spouse, partner, adult child, parent, sibling, or friend who is willing to care for you. For multiple caregivers, a written schedule with each person's time needs to be made prior to transplant. Your caregivers need to be available most of the time each day. Caregivers are important for your safety and can help you with many daily tasks, including transportation, meal preparation, cleaning, medication management, central line care, emotional support, and seeking emergency medical care if needed. Your caregiver does not need to stay with you 24/7 while you are in the hospital, though they are welcome to do so. Before discharge, we will provide your caregivers with instructions and information for what to do when you return home or to your local lodging. It can be very demanding to be a caregiver. It is important for your caregivers to be healthy and seek support when needed. Our social workers and psychologists can help connect caregivers to available resources. Upon discharge from the hospital after transplant, it is required that you stay within 30 miles of the hospital for your safety. If you do not live within 30 miles of the hospital, our social worker will speak with you about looking into temporary lodging options. For autologous transplant, this is for 1 to 2 weeks after discharge from the hospital. For allogeneic transplant, this is until day plus 100 after transplant. If you have any questions regarding local housing arrangements, please contact our social workers. They can provide an up-to-date local lodging list. We advise you or someone on your behalf to check out the lodging options in advance. UC Health does not inspect or approve these facilities, therefore cannot assume any responsibility for the accommodations or charges. Some insurance providers offer travel and lodging benefits for patients who travel beyond a certain distance. Our financial case coordinators can find out if this is an option for you. It is your responsibility to determine how to access travel and lodging benefits by contacting your insurance company. Chemotherapy and transplant can cause infertility. If you have any questions about your fertility, please talk to your oncologist and coordinator. It is required that you do not smoke any form of tobacco or marijuana throughout the transplant process. This is to reduce your risk of infection and for your overall health. If you would like more information on smoking cessation, please contact one of our psychologists. Dental care is also important as the mouth can be a source of infection following a transplant. If possible, you should receive a dental examination and cleaning prior to transplant. But please talk to your coordinator before scheduling any dental procedure. Insurance approval is required for all pre-transplant testing and the transplant itself. Our financial case coordinators will submit these requests to your insurance company. The next step for preparing for transplant is a medical evaluation or pre-transplant workup. This is usually done 30 to 60 days before your transplant. Your coordinator will provide you with a specific schedule for your workup. It could include a bone marrow biopsy, chest X-ray, labs, echocardiogram, pulmonary function test, EKG, and meetings with a dietitian, psychologist, social worker, pharmacist, and your physician. The next step in preparation is selecting a donor. If you are having an autologous transplant, we will use your own stem cells for transplant. If you are having an allogeneic transplant, you will have someone else as your donor. It will be a family member, a matched unrelated donor, or cord blood units. If we are using a family member, it will most often be a sibling, parent, or adult child of a patient. Where do the stem cells for a transplant come from? Bone marrow. This is the soft, spongy tissue found inside of our bones. Stem cells live in this tissue. Peripheral blood. Stem cells sometimes leave the bone marrow and circulate in the peripheral bloodstream, only a small number normally. Umbilical cord blood. At birth, there are a large number of stem cells circulating within the placenta and umbilical cord. They can be collected at that time, frozen, and stored. Your physician will discuss with you which donor source will be used for your transplant. Family member donors will have their stem cells collected here at the University of Colorado Hospital, either several weeks before or several days after you are admitted for transplant. Cord blood transplant uses stem cells that are taken from an umbilical cord donated right after birth. They are shipped to UCH just before the transplant admission. Matched unrelated donor transplants use a donor from the general population who is not related to you but who is a very close match genetically. Most are from outside the state or even the country. For donations occurring outside UCH, the cells are delivered via courier. If you have friends or family members who wish to register to become a potential donor for someone in need, they can go to the National Marrow Donor Program /Be the Match Foundation's website at www.bethematch.org. Autologous patients will have their stem cells collected here at UCH before transplant admission. They will be frozen and stored until the time of transplant. Remember that stem cells live inside the bone marrow. How do we get stem cells out of the bone marrow and into the peripheral bloodstream? Mobilization. Through the use of medications, we stimulate the growth of extra stem cells and encourage the stem cells to leave the bone marrow and move into the bloodstream for collection. This process is called mobilization. Apheresis. This is the most common type of stem cell collection. It is done by drawing blood out of the donor, a small amount at a time, through a central line in the chest, or IV in the arms, through a machine that separates stem cells out of the bloodstream. The stem cells are collected, and the rest of the blood returned to the donor. This process takes 5 to 6 hours. The next step in preparation is the placement of a central line. A central line, also known as a trifusion line, is usually inserted before the start of collection for autologous patients. This line will be used for both the apheresis procedure and stem cell transplant. It will remain in place for the entire transplant process. Most related donors don't need a central line for collection. In most cases, 2 large peripheral intravenous catheters, or IVs, will be placed in the arms. If IVs cannot be inserted, a temporary central line will be placed. Allogeneic transplant patients will have a trifusion line inserted on their day of admission to the hospital for transplant. You and your caregiver will be given education on how to care for your central line at home. This is a trifusion central line. Preparing for the apheresis procedure. It usually takes 1 to 4 days, depending on the goal number of stem cells to collect for autologous patients, and 1 to 2 days for related donors, 5 to 6 hours per day. Your coordinator will give you a specific schedule and instructions on how to prepare for stem cell collection for both autologous patients and related donors. The timing of stem cell collection will vary depending on the type of disease and type of transplant. Please remain flexible. Stem cell mobilization and collection can be very unpredictable for autologous donors. In some cases, it has to be repeated, though this is rare. What to expect during an apheresis procedure. Arrive at 7 a.m. and eat breakfast before you arrive. Wear comfortable clothing. You will not be able to leave at any point while attached to the apheresis machine. You will be able to order food from the hospital kitchen, or you can bring your own food. You may bring things to pass the time, reading materials, movies, etc. These are the steps we have covered so far. So, what is next? Admission for transplant. Your doctor and coordinator will let you know how long you can expect to be in the hospital. The length of time varies depending on the type of transplant, your diagnosis, and your conditioning chemotherapy. For information on what to bring to the hospital, please see the Blood and Marrow Transplant book. Upon admission, a central line will be placed if you do not already have one. The conditioning chemotherapy will then be started. What to expect on the day of your transplant. The day you have your transplant and receive your stem cells is called Day 0. The infusion of stem cells is very similar to a blood transfusion. You will be given pre-medications in order to prevent reaction to preservative that stem cells are frozen in if they are not freshly collected product. You will also be connected to a telemetry monitor, which monitors your heart rhythm and heart rate. Your vital signs will also be monitored frequently for a few hours following the infusion. The stem cells will be infused by a nurse through your central line. The infusion can take as few as 15 minutes. From day 0 until engraftment. The next step is waiting for the stem cells to grow. This is called engraftment, which usually occurs between 10 to 30 days after your transplant day 0. Engraftment is the point when the new stem cells have migrated to the bone marrow and start to make white blood cells, red blood cells, and platelets again. Engraftment is when your body starts making neutrophils, which are a type of white blood cell. You will be monitored closely for potential complications such as infection and bleeding. We will talk more about the daily routine and what to expect during your hospital stay shortly. Patient responsibilities while in the hospital. Communicate with the healthcare team about how you are feeling. Get out of bed. Studies have shown that daily exercise results in fewer complications and earlier discharge. Remind your family and friends not to visit if they are sick. Be assertive. Ask for what you need. What to expect during your transplant hospital stay. During and after your transplant, you are at a very high risk of getting an infection. You are not infectious. We just want to protect you. Ways you can help prevent infection. While you are here, you will need to remain on the transplant unit behind the double doors. Exceptions are tests and hall pass, which will be explained in more detail upon your admission. When you are off the inpatient unit, wear a mask. Wash your hands frequently. Shower every day. With limited access to the outside world, it is common to feel isolated. We highly encourage family and friends to be involved and visit. Visitation rules. No visitors who are sick or who have been caring for someone who is sick. Please have them do strict hand washing. No restrictions on visiting hours. No visitors under the age of 12 are allowed on the unit. If you foresee this being a problem, please talk to your coordinator. Do's for your hospital stay. Make your room comfortable during your stay. Feel free to decorate your room as long as items can be removed without damaging walls. Bring pictures, posters, books, comfortable clothes, movies, puzzles, laptop computers, personal care items. Please make sure they are clean. If there is something you are unsure about bringing, please ask your coordinator for clarification. Leave your medications at home. Do nots for your hospital stay. No fresh flowers or plants. No mattress covers or overlays. No real feather or down pillows. No furniture or electrical appliances. No water aromatherapy, diffusers, or humidifiers. Only electric razors. Leave expensive personal items at home. No weapons. No marijuana products or vaping devices. Fall risk. Patient safety is our #1 priority. There are many factors that can increase fall risk or the risk of injury if a fall does occur, such as IV pumps, IV lines, physical illness, dizziness from medications, low platelets or low hemoglobin, fatigue, and a new environment with lots of equipment. A nurse will assess your fall score upon admission and every shift. This score is based on all these factors and more. In order to ensure your safety, we may utilize a bed alarm. This does not restrict your movement. It does ensure that a staff member is aware when you get out of bed. If you are a high fall risk, a bed alarm is required and a nursing assistant or nurse is required to be with you and stay with you when you use the restroom or go for a walk. You will automatically be considered a high fall risk if your platelet count falls below 10. Please notify staff right away if you feel dizzy, lightheaded, or short of breath. Activity. Inactivity causes you to rapidly lose strength and increases your risk of falling, blood clots, and pneumonia. Physical therapy will work with you to ensure that you stay as active as possible. Try to walk at least 3 times a day outside your room. The BMT unit has 2 exercise bikes, 2 treadmills, and hand weights for you to use at any time. However, depending on your platelet and hemoglobin levels, your exercise options may vary. Always talk to your nurse prior to starting any activity to ensure that there are no restrictions. Prior to transplant, you will have a central line inserted. You will have IV fluids or medications connected to your central line continuously. You will not be disconnected to work around clothes or showers. Each time you are disconnected and reconnected, it increases your risk for infection. We encourage you to wear button-up shirts or hospital gowns to allow easy access to your central line and IV tubing. Leave all your medications at home. We will supply all of your medications. Do not touch the IV pumps if it beeps. Please press your call light so your nurse can help you. Never take any medication that is not given to you by the nurse. You will begin taking new medications such as chemotherapy, electrolytes, and post-transplant anti-rejection medications for allogeneic transplant patients. As you get closer to discharge, your daily nurse, the resource nurses, and our inpatient pharmacist will review medications. We will also help you fill your pill case to go home. After transplant, you will again meet with the outpatient pharmacists to make sure you understand your medications. Shift change occurs at 7 a.m. and 7 p.m. Your current RN and the oncoming RN will come into your room, introduce themselves, give a brief update, and discuss any questions and/or goals you might have. If you prefer not to be disturbed at this time, please alert your nurse, as this is the expectation of them. This is your opportunity to speak up and ask questions. Your daily routine will include vital signs performed every 4 hours, even at night. At 4 a.m., blood will be drawn for labs. At 7 a.m., change of shift and your weight will be taken. 8:30 a.m. to 11 a.m. is bedside rounding with your care team. 7 p.m. is change of shift again. Throughout the entire day, you will be receiving IV fluids, electrolytes, medications, or blood products, depending on your daily lab values. Hourly rounding. A nurse or CNA should be checking on you at least every hour. If you are asleep, they will leave you undisturbed unless they have a concern, a medication, or other intervention that is required. Multidisciplinary bedside rounds. Between 8:30 a.m. and 11 a.m., Monday through Friday, the entire care team will come into your room for bedside rounds. This may include the physician, nurse practitioner, or physician assistant, your primary nurse, case manager, pharmacist, and dietitian. On weekends, although rounds will still be occurring, they will be held in a separate conference room. This is the time for you and your family to ask questions and ensure you understand the plan for the day. There are many things you can do to help yourself to heal. These include be active. Spend most of your day out of bed. Go for at least 3 walks per day around the inpatient unit. Good mouth care. We will teach you how to do a salt and baking soda rinse 4 times a day. Shower every day. We have a special soap that helps prevent infections. Eat a healthy diet. Discharge teaching. You and your caregiver are required to take part in discharge teaching prior to leaving the hospital after transplant. A nurse will set up a time to come to your inpatient room for this 1-hour teaching session. It is usually done within a few days of anticipated discharge from the hospital. Post-transplant survivorship. What happens next? After hospital discharge, you will be seen for infusion support in the Blood Disorders Infusion Center. Although some autologous patients may return directly to their own local oncology clinic, The frequency of visits will vary and decrease as you recover. You will see a provider weekly. Recovery can be a slow process. Take it one day at a time. Your new immune system is growing and developing. This takes time and energy. Most patients feel very tired as they are recovering. Have reasonable expectations of what you will be able to accomplish. Our goal is to support your recovery and manage any complications you may experience. Recovery. Taking care of yourself. Check your temperature 2 times a day and notify us immediately if you have a temperature greater than 100.4 degrees for over 1 hour. Infection control. Be vigilant. Hand washing. Avoid sick people. Avoid large crowds. Exercise will help you recover faster and increase energy overall. Follow all discharge instructions. Guidelines are in place to keep you safe. Communicate with your BMT team. Your physician will determine when it is safe for you to return home if you do not live locally. Your care will be coordinated with your local oncologist. What follow-up is required at UCH? For autologous transplant patients, additional follow-up care will be determined between your transplant physician and your local oncologist based on your individual needs. For allogeneic transplant patients, there will be an initial survivorship visit at around 90 days after transplant, then again at 6 months, 9 months, and 1 year after transplant. Long-term recovery and survivorship. Cancer survivorship is living with, through, and beyond a cancer diagnosis. This process looks and feels different for every person. We will help to facilitate a smooth transition of care to your other providers. All patients must re-establish care with the PCP by 6 months post-transplant. Preventative health maintenance is crucial after transplant. We can also help with paperwork for returning to work or for disability claims. We will help with starting your post-transplant vaccines 12 months after transplant. And we will arrange comprehensive long-term survivorship follow-up visits in the months and years after your transplant. This booklet can be very helpful in the long-term post-transplant period. Contact the address listed here for a copy. The Blood Disorders Infusion Center, also known as the BIC, is located on the 2nd floor of the Cancer Pavilion. The BIC is responsible for general assessment and triage, infusion of IV fluids, electrolyte replacements, blood products, chemotherapy, antibiotics, and vaccines, rapid response fever protocol, central line care and teaching. The BIC is not responsible for emergency care or treatment such as chest pain or stroke symptoms. Provider visits with physicians, nurse practitioners, or physician assistants unless pre-scheduled or urgent day of needs. Medication refills. Please address at provider appointments or call the BMT Medication Refill line at 720-848-0687. What to expect during your infusion visit. Vital signs and blood draw. Wait 45 to 60 minutes for lab results. A nursing assessment. Electrolyte replacements. Blood products or chemotherapy as needed based on the lab results or treatment plan. Length of appointment varies each visit based on individual needs. Snacks and drinks available while you wait. Families are welcome to bring food from home or the cafeteria. If you come to the BIC with a fever, expect any or all of the following. You will need to wear a mask, IV fluids and or antibiotics, blood cultures and urine sample, nasal wash sample taken, frequent vital sign monitoring, possible admission to the hospital. Please contact us immediately if you have a fever. Do not wait for your next scheduled visit. To prepare for your big visit, you should have a ride to and from all appointments until cleared to drive. Plan to be at the BIC for a minimum of 2 to 3 hours, and as long as 6 to 8 hours based on your needs. Snacks and drinks are available, but bringing outside food and drink is preferred. Please arrive at the BIC on time. Hold certain meds, such as tacrolimus, cyclosporin, or sirolimus on designated days, and bring to your appointment to take after your blood draw. The BIC can be chilly. Bring layers in all seasons. If you need to speak with someone about a new or worsening symptom during business hours, please call 720-848-6400 and press the option to speak with the triage nurse. Your care is important to us. Nutrition during stem cell transplant. You will have a team of oncology nutrition experts working with you in the Blood Disorder Center. This team is composed of registered dietitians who are certified specialists in oncology, nutrition, and certified nutrition support clinicians. You will have nutrition visits at 3 different points in your transplant process: pre-transplant, during transplant hospitalization, and post-transplant and survivorship. Your team will conduct a nutrition assessment and intervention. This will include an assessment of nutritional intake, an evaluation of your weight history, an identification of barriers that may impact nutrition and hydration, an analysis of lab results and vital signs, and an assessment for nutrition support need. What kind of nutrition interventions do we do? Oral nutrition, which includes diet modifications due to treatment-related side effects and oral nutritional supplements. Enteral nutrition, which is supplemental nutrition support when unable to maintain weight and lean body mass by oral diet alone. This is done using a temporary or long-term feeding tube. When this is needed, it is primarily during the transplant hospitalization. Parenteral nutrition is intravenous nutrition that is used when the gut, oral or enteral route is not tolerated or is unable to be used. Education is also an important part of your nutrition team's role. They will educate patients and caregivers on the importance of meeting nutritional needs prior to, during, and post-transplant. They will also provide education on the immunocompromised diet and food safety. Your nutrition is important in improving your outcomes. Patients with cancer and poor nutrition status have lower response to treatment, lower survival rates, poorer quality of life and performance status, higher overall treatment costs, longer length of hospital stays, and increased risk of infection. The pharmacist role on your stem cell transplant team. The Blood Disorders Center Pharmacy Team, the drug experts. They have completed specialized postgraduate training in blood cancers. Our clinic pharmacists assist providers with drug selection and dosing, order and prepare chemotherapy and supportive care medications, assist with medication access and cost issues, and have pre- and post-transplant meetings with allogeneic transplant patients. They are based in their own clinic and do not work for the pharmacy itself. Our hospital pharmacists attend rounds daily with the medical team, order and prepare chemotherapy and supportive care medications, and organize prescriptions for discharge. Medication access and organization. There are 2 retail pharmacies at UCH. AOP Pharmacy, which is located on the first floor of Anschutz Outpatient Pavilion, and Atrium Pharmacy, which is located by the main entrance of Anschutz's Inpatient Pavilion 1. Specialty pharmacies are pharmacies that provide medications that are very complex and expensive. They are often out of state, but will deliver medications to the address of your choice. Some insurance companies may require you to use a specialty pharmacy, or a medication prescribed for you may only be available at a specialty pharmacy. Our Medication Access and Renewal Center will work with you and the clinic pharmacists to coordinate the logistics of medication delivery. Medication delivery. For inpatients, discharge medications can be delivered to your inpatient room. For outpatients, the AOP pharmacy can deliver new medicines and refills while you are in the BIC. How to get refills. If you have refills, check your pill bottle to see how many refills are remaining. Call the pharmacy where you picked it up. The phone number is often on the pill bottle. If you do not have refills, contact the BMT refill line at 720-848-0687. Allow 72 hours for the clinic to process. Please leave as much information as you can regarding your prescription. This is likely the largest number of medications you have been required to take at once. Even though it won't last forever, it can still be overwhelming. Pharmacists can help with the following. Alleviate or mitigate side effects associated with taking multiple meds. Schedule or add anti-nausea meds. Change drug formulation for ease of swallowing. Recommend alternative medications when possible. Arrange and organize medications, provide pill box management suggestions, and coordinate refills. And provide education on any medications that are added throughout the transplant process, including chemotherapy, prophylactic therapy, and supportive care medications. Herbal and dietary supplements. Companies that make these products are not regulated under the same stringent manufacturing guidelines required by the Federal Food and Drug Administration for prescription medications. There can be potential contamination with plant-based toxins, bacteria, bacterial toxins, and fungal spores. Natural does not always equal safe. Most prescription medication are derived from plants and other natural sources. Many herbal medications interact with prescription medications in negative ways. Please let us know about all products you use or take. We recommend that you stop the use of all potentially harmful herbs, teas, and supplements during your transplant course. Psychology's role on your stem cell transplant team. Why do we have psychologists on our team? A diagnosis of cancer is distressing. Our program values your well-being and emotional well-being. In many cases, it's related to improved outcomes post-transplant. Adjustment to quality of life changes, shifts in family roles, and social changes are common. Navigating the complicated world of modern medicine, decision-making, support of family and caregivers, and more. Coping with stress. We all learn to cope with difficult life situations, but at times our coping can be temporarily overwhelmed by stressors. Our psychologists can help when you're feeling overwhelmed. Some of these techniques include breathing techniques, changing behaviors, tips to manage unhelpful thoughts, muscle relaxation, and guided imagery. The perception of having little control is common in stem cell transplant. What can you do to help you through this time? Focus on aspects you do have control over. Find ways to let go of things that are beyond your control. Live with uncertainty. Acknowledge fear and other strong emotions directly. What patients say helps. Establishing a routine in the hospital, getting out of bed and showering around the same time each day, walking the halls, staying active, staying well informed about your medical plan, talking with friends and family, in person or on the phone, approaching treatment one day at a time, connecting with spiritual and religious resources. Exercise has many benefits. It can help manage and buffer against the effects of chronic stress. It can be as good as Prozac for people with depression. It reduces fatigue long-term and enhances appetite. Communicating with family and friends. If you start to feel drained by a number of calls, emails, or visitors you're receiving, it is helpful to set limits with friends and family, such as telling them now is not a great time for a visit, or you only plan to return calls and emails once a week. Tell others how they can help. Many friends and families want to be helpful but aren't sure how, so tell them. They will likely feel relieved to have something to do. For example, I need a ride to an appointment. Or, it would be great if you could drop off some food on Tuesday. You may want to use a site like caringbridge.org to post information securely about how you are doing so friends and family can stay informed and connected with you. For your psychology team, the process includes pre-transplant evaluation and then check-in between days 60 and 80 post-transplant. The same psychologist will follow you from outpatient to inpatient. We offer many types of psychological support: individual, couples, and family in-depth therapies, and basic tools for stress and mood management. With what kinds of things can we help you? Managing stress and uncertainty, coping with physical symptoms like pain and nausea, problem sleeping, caregiver and family stress, relationship issues, facilitating communication with the medical team, and increasing motivation for things like exercise and diet, coping with hospitalization, and helping manage high-risk behaviors. When to contact us? You can contact your psychology team when you are feeling very down or blue for more than a few days, have low motivation that is preventing you from following your medical plan, have feelings of guilt, anger, or hopelessness, seeing or hearing things that others do not, nervousness, anxiety, or feelings of panic, conflict between you and your family or caregiver. When not to contact us. If you find yourself developing a plan to hurt yourself or take your own life or intend to act on this plan, this is a mental health emergency. Please call 911 or have your caregiver take you to the nearest emergency room immediately. 911 is in the best position to handle such an emergency. Taking care of our caregivers. We ask a lot of caregivers. They juggle multiple roles and can experience more stress than patients. Providing support for caregivers has been shown to be highly effective. The role of social work on your stem cell transplant team. Oncology social workers are part of our psychosocial support team. They are available to assist patients and families in managing the stress associated with the diagnosis and treatment of cancer, including emotional distress and support, financial and insurance issues, relationship issues, caring for a loved one with cancer. During your treatment, your social worker team can help with support in navigating the medical system, addressing any barriers to care and treatment, such as transportation and lodging, financial resources, supportive resources, family support, and emotional coping interventions. We are here for you at all times throughout your treatment and survivorship. Preparing financially. Frequently asked questions. What do I do about income? Social Security Disability Income, or SSDI. Treatment with a stem cell transplant is considered automatically medically disabling, according to the guidelines established by the Social Security Administration. Many people receive SSDI during the course of their treatment and recovery, and then, once they are able to return to work, discontinue their SSDI benefits. If you have been working and paying into Social Security for the required time period, you should be eligible for SSDI, assuming you are not able to work. To find out if you are eligible for SSDI, call the number on the slide or go online to start the application process and determine if you are eligible to receive SSDI benefits. Employer-provided disability benefits. Some employers offer disability insurance, both short and long-term disability. Sometimes these plans are automatically offered as part of an employee's benefits, and sometimes the employee can purchase these plans as part of his or her benefit package. Please contact your Human Resources Department to determine your disability coverage. How do I protect my job, and how does my caregiver protect their job when they are providing care for me after transplant? Family Medical Leave Act, or FMLA. FMLA allows an employee to be absent from work for a medically related issue for him or herself, or to care for an immediate family member for up to 12 weeks that do not need to be consecutive in a 12-month period. While FMLA protects an individual's job, it does not provide income to the individual. An individual may receive income while on FMLA if he or she has paid time off accrued. There is usually paperwork associated with FMLA that must be completed by a healthcare provider. Your nurse coordinator or social worker can assist you with this paperwork. Please contact your Human Resources Department to determine if you are eligible to receive FMLA benefits. What do I do about change or loss of my medical insurance coverage? I have questions about my insurance coverage. Who do I contact? If you are having trouble with or have questions about your insurance and its coverage, please contact our Transplant Financial Case Coordinators at the number listed on this slide. Advance directives. Legal documents that allow an individual to determine and specify their level of care when facing aggressive treatment or life-threatening medical situations. Advance directives allow family, friends, and healthcare professionals to know your wishes and avoid confusion or indecisiveness should you be unable to communicate your wishes directly. Common examples of advance directives include living will, medical durable power of attorney, 5 wishes, and CPR or most forms. Your social worker can help you complete your directives and can help facilitate discussion and education between you and your family, friends, and caregivers. Medical Durable Power of Attorney. This is a document signed by you authorizing another individual, also known as your agent, to make healthcare decisions on your behalf if you cannot do so yourself. The agent you elect can also obtain copies of your medical records and consult with your doctors and healthcare providers while making medical decisions necessary for your care. You can elect or change your agent at any time by signing a new MDPOA document. You should have a current MDPOA in your electronic medical chart before coming into the hospital for treatment. Support groups. Support groups are available to patients, families, and caregivers. Group facilitators include social workers, psychologists, and nurse coordinators. Please let your social worker know if you are interested in a support group or if you have any questions about them. The Cancer Resource Center has many helpful services and materials. You may visit the center anytime you are in the Cancer Center and utilize their many resources. Transplant Financial Case Coordinators. The Transplant Financial Case Coordinators are a part of your transplant education team. They are available to review your insurance-related options and assist you in applying for programs that may fit your needs. They will obtain benefit information from your insurance company and will also obtain the necessary authorizations for the stem cell transplant evaluation and procedures from your insurance company. Please let them know as soon as possible if you have any coverage changes. The TFCCs can assist you with coverage changes and questions you might have related to open enrollment or loss of insurance before and after transplant. Medicare and Medicaid. If you have Medicare Parts A and B, you must have a secondary insurance plan and a Medicare Part D for a transplant. A secondary plan can include a Medicare supplement or Medicaid with medical coverage. A Medicare Advantage plan satisfies the requirements for Medicare A, B, D, and a secondary plan. Medicaid is a state insurance that is income-based. There are different types of Medicaid programs, such as the Medicare Savings Program, which can help to pay Medicare Part B premiums, as well as co-insurance and deductibles. Requirements to qualify for Medicaid are different in every state, and which medical treatments are covered varies. The Healthcare Exchange, aka Marketplace, and Social Security Administration. The Healthcare Exchange is an insurance marketplace where one can purchase insurance if needed. Tax credits may be available to help make your premiums more affordable. Enrollment in the marketplace is open from October to January every year. You may be eligible for Social Security Administration benefits. The Extra Help Program may be able to assist with insurance premiums for Medicare Part D. Social Security disability insurance may be available to you if you meet certain disability and medical criteria. This may mean you qualify for Medicare health insurance if you are under the age of 65. Your assigned transplant financial case coordinator will give you their information when they speak to you. Call them directly if you need additional assistance. If you have insurance questions or concerns, your transplant coordinator and social worker can forward a request to your transplant financial case coordinator to contact you. Palliative care team members. When you feel better, you do better. Your quality of life is important to us, and we want to focus on you and your loved ones feeling your best every day. Planning your care. We help your voice to be heard, helping to complete important forms like a medical durable power of attorney, helping you talk to your loved ones about what matters most to you, making sure your medical team has the important forms in your medical chart. Here are some resources that may help you during this process. Thank you for listening to our webinar.